All right. Looks like everybody is connecting to audio. I see new faces popping up. Welcome, welcome. I'm Jeanette Davenport, one of your kidney team social workers. I see some folks still connecting. So we'll give everybody a minute to finish logging in. But of course, this is our monthly education group. Um, Today, our speaker, we have a fabulous speaker. And actually, Kristen, I meant to ask you how to correctly pronounce your last name. I want to give it a guess. Wait a minute. Dobrowolski?
You're very close.
Oh, darn.
Dobrowolski.
Dobrowolski. Darn
Much
it. Oh,
closer than most people.
I usually just call you Kristen. There was no.
Yes.
But anyway, she is our fabulous speaker today. And as you saw in the invitation, our topic is stress and what is it, how to manage it. I just wanted to kind of let everybody log in. What we'll do today, our same format as usual. We're going to introduce Kristen and then kind of let her have the floor to talk to us about stress. And then, of course, we'll open it up to questions. If you guys have questions throughout the meeting, if you want to throw them in the chat, I'm happy to moderate that for Kristen. Keep an eye on it, and we'll make sure we get all questions answered before the end today. But just to share with you all a little bit about Kristen, she is a licensed clinical social worker here at Mayo. She works with our psychiatry and psychology department, offering 2-day cognitive behavioral treatment programs for patients with chronic conditions like fibromyalgia, chronic fatigue, POTS, and chronic abdominal pain. Kristen's been utilizing techniques from a cognitive behavioral therapy through her practice for over 10 years. Prior to coming to Mayo Clinic, she worked with adolescents and their families dealing with impacts of mental and behavioral health in rural communities. She is an instructor of social work here at Mayo and engages in research that focuses on the impact of these tools on chronic conditions to assist patients in managing symptoms. We felt like Kristen would be a fabulous speaker for you guys since she does. So there's so many similarities, I feel like, between some of these conditions and what patients experience with end stage and chronic kidney disease as they await transplant. So welcome, Kristen, and I will turn the floor over to you.
Perfect. Good afternoon, everyone. As Jeanette said, my name is Kristen Dobrowolski. I'm a licensed clinical social worker here at Mayo. And as she mentioned, I do work with patients who experience chronic conditions along with their families related specifically to dynamics of chronic pain, widespread body pain, but also chronic conditions related to fatigue. And so fatigue and pain tend to kind of travel together in the body as far as how it's communicated in terms of the experience, but also the impacts as far as how it really guides our day-to-day engagement. And one of the biggest things that really does impact our body's ability to manage that is stress. And stress is one of those things that I oftentimes say, and kind of joke about in a sense is that it's not something that many of us say, oh, I'm stressed until it hits a mental or an emotional impact. The challenge with that, though, is that's not oftentimes the first sign of stress. Stress is actually this physiological process that the body goes through that really does almost kind of, in a sense, wreak havoc on all of the systems of the body before our mind even registers that it's going on because of what's happening in the different nervous systems of the body. So, we're going to talk about what is stress, what does it look like for each individual person, because it will look very different. A lot of us have our own stress signals, our own stress symptoms, but also how we manage it is going to look very different per person, but also per situation. There are some things that I personally do when I'm stressed about work things that are very different than what I do when I'm stressed about personal things versus relationship dynamics versus, traffic. Stress comes from a lot of different kind of outlets within our day to day. And so we have to find different ways to manage it. And so we'll talk about what those look like. I want to make sure that I can get this to click. Over the course of the next 40 minutes or so, we're going to really look at understanding where stress comes from, what the impacts of it are on us as a whole person. I don't know if you know this, but you are a whole person. You're not just physical symptoms. Also, the mental and emotional toll that those symptoms, as well as the symptoms that your loved one kind of goes through really impacts us on a holistic level, not just in one way, shape, or form. So, we're going to talk about all of those impacts. We're going to work towards understanding the body's autonomic nervous system, which controls and regulates all of the body's vital functions. So, organ management in terms of how they are functioning and responding to systems in the body because they change when we go through this stress response. The autonomic nervous system contains what's called your sympathetic activity, which activates that fight or flight response. A lot of us learned about fight or flight back in eighth grade science. They probably use some kind of example related to a tiger in the woods, but many of us don't run into tigers in the woods very often. So we're going to talk about a bear instead. But we're going to talk about that fight or flight response and how it really does change the body. We're also going to learn how stress can contribute to difficulties relating to difficulties in functioning and how learning strategies for turning down that autonomic symptom. We use the term POTS a lot because it oftentimes has an impact on things like our orthostatic side of things, which I'll touch on a little bit more, as well as anxiousness associated to it, to be able to successfully return to day-to-day functioning, but also really look at developing a plan for managing stress overall that involves dynamics of self-care. And so when I say the term self-care, I am not referring to all the fancy stuff you probably see all over the internet where they tell you should go spend all sorts of crazy money on different skincare, hair care treatments. We're talking self-care in the form of taking care of your human body. We have to walk around with that thing all day long. And so we want to make sure it's in a state where we can really do that to the best of our ability, but also not just in terms of surviving certain stressors, but also thriving in those. When it comes to stress and the autonomic nervous system, your autonomic nervous system is all of the automatic stuff. So when we say autonomic, we think automatic. This is the stuff that takes place behind the scenes that we do not really invest any kind of energy into making happen in terms of kind of our brain power or even kind of directed functioning. So we don't stand here and say, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out all day long. That's just how the autonomic nervous system operates. It's also going to include things like our heart rate, blood pressure, things like when you go to stand up. When you stand up, your body goes through this process of signaling that your heart rate, your blood pressure, as well as kind of the constriction in the body are all supposed to coordinate so that when you do stand up, you don't fall over. That's part of that autonomic nervous system as well. The process of digestion is actually triggered through this system. And so oftentimes, many people's tummy gets involved in the stress response system. And so oftentimes people say, when I'm really stressed, my stomach is kind of all over the place, or, I got so nervous. I felt like I had butterflies. That emotional connection with the gut travels through this autonomic response. When it comes to stress, just a little bit about what it is. First and foremost, it's normal. We go through stress all day long. It's good, it's bad, it's positive, it's negative. It's also real or imagined. So when I say the term imagined stress, what I'm referring to is this dynamic of what humans do in terms of what if. So this might be the case of, well, what if I go to this appointment and I don't hear the information that I want to hear? Or what if they tell me that I have to do X, Y, and Z? Or what if I'm on the way to the grocery store and this happens? The what if sensation really ramps the stress response up in the same way that an actual stressor would. So this physical or mental reaction to these types of events is that stress response. It's defined as any kind of demand that requires us to react, whether it be internally or act on an external level. In some cases, for some people, stress just hits us on a mental or emotional level, and we're able to manage it there. In some cases, certain kinds of stress require us to act in terms of things like a car accident. If you get in a car accident, you do have an emotional connection to what just happened, but you still have to get out of the car and you have to exchange insurance. You have to talk to the other person. And so prompting that action. On the other side, there are also things called positive stressors. So, oftentimes, when you say positive stress, people use examples like planning a party or planning a wedding. Some people think that's positive, some people think that's just stressful all around. But when it comes to those kinds of events, oftentimes you're planning something that has a grand kind of positive sensation at the end or finish line, but your body going through that stress response is going to look exactly the same as it would in a car accident. Your body doesn't decipher between the two. The process still kicks off in the same way. It becomes a problem when the demand of the stressor, or in most of our cases, those multiple stressors, actually exceeds our ability to cope with it. And I don't know about you, but stress for me doesn't take turns. It doesn't go stress number one, then stress number two, and then three. Usually one, two, five, seven, and nine are all kind of all happening all at once. And then 12, 14, and 32 join the party. And so what happens is it starts to pile up. And it really exceeds our ability not only to cope with what's going on, but also manage to be able to move through it. Our body responds by going through this fight or flight sensation or fight or flight response that not only can hit that mental and emotional threshold, but oftentimes does change the way that the body is operating because of this response. Now, there's a lot of language these days on different forums, different kind of podcast things that you hear about the fight, flight, fawn, or freeze process. Fawn and freeze really are much more personality driven, whereas fight or flight is really this physiological process that happens within the body. So, what happens is there's some kind of external event. So, we're going to talk about our friend the bear. Now, oftentimes we use the example of going through the woods simply because this can be pretty stressful when you're met with an animal that potentially could harm you pretty severely. I myself am not a camper. I am a camp in a hotel with an ocean view kind of person, but let's pretend we're going to go camping in the woods. So let's say we go out and we find a good place to pitch our tent. We're kind of off the trail just a little bit, but easy access. We set up our tent, we get all the stuff out. We decide to go ahead and kind of close everything up, get into our tent. It's time to go to sleep. We get in the tent, get all cozy up in our little sleeping bag. We zip the tent all the way up. We turn off the flashlight. We lay down to go to sleep. And all of a sudden, we hear some rustling outside. Now, for some reason, we thought it was a good idea to unzip the tent. When we did that and we saw this bear out there, this external event as of seeing the bear is actually perceived as a threat by our brain. At the time, our brain then prompts this fight or flight response to kick in. And so, what it does is signals for adrenaline, noradrenaline, and cortisol, which are this part of the stress hormone bunch, releases into the body. And when it does that, it's signaling to that autonomic nervous system that certain processes need to change so that we can survive this situation. The autonomic nervous system is about survival as well as thrival. In this case, what it's telling it, what the brain is telling the autonomic nervous system is we need to go into survival mode to ensure we can get out of this situation and kind of move to the next phase. So what happens when these chemicals are released is the heart rate actually starts to increase, your breathing rate starts to increase, which then increases your body temperature. So when it does that, you actually start to sweat more so that your body tries to cool itself down. Also, just as a weird evolutionary fact, sweating makes you slippery, so it's harder for the bear to grab you. At the same time, the fats and glucose are released into your body for energy. So your brain gets this signal of, I'm going to need some energy to make sure that if I'm about to have to run or fight, I've got some energy to do that. So the fats and glucose that are stored in your muscles are going to be released for your body to use. At the same time, your blood flow actually gets diverted from what's considered to be your non essential body areas. Now, I don't have any of those. I don't know about you, but all of mine tend to be essential in terms of how my body operates. But in this kind of process, your brain determines that your extremities, so your arms and your legs, are actually not considered essential to survival. The reason being is that they don't contain any organs in terms of the survival process. All of your main organs are going to be located in the middle area of your body. And so all that blood flow gets diverted there to protect those to ensure that they function. At the same time, all this is happening, your body starts to turn off certain things that aren't necessary for in the moment survival, one of which being your immune system. Your body says, why in the world do I need to fight a cold if I'm about to have to fight a bear? Which is pretty valid. And so let's say we decide to get out of that tent. We're going to flee instead of try to fight because I'm not trying to fight a bear. I don't know about you, but we get out of the tent. We run back up the trail up to the ranger cabin we saw on the way there. We get inside, close the door, tell the ranger, hey, there's a bear down by where my tent is pitched. I don't know what to do about it. Please help. The ranger says, don't worry about it. I've got it. Lock the door. The threat has been removed at that point. What this does is signal to the brain, hey, this threat has been removed. And so the brain processes this release of acetylcholine. When acetylcholine gets released, it actually signals to the adrenaline, noradrenaline, and cortisol to lower. When that happens, the body is supposed to being the key word, return to normal. Now, this fight or flight response happens within that autonomic nervous system, and it's a balance of what's called your sympathetic and parasympathetic activity. So, when that fight or flight response kicks off, your sympathetic activity, which is the stuff here in the middle of this image, where your pupils dilate, your saliva flow actually starts to become inhibited, your heart rate increases, it becomes a little more difficult in terms of breathing because the breathing rate has started to increase. But it also inhibits factors related to digestion, along with things like your bladder. Most of us in a high stress period don't think about having to go to the bathroom. What's supposed to happen when the stressor gets removed and that acetylcholine prompts the drop in chemicals is the parasympathetic is supposed to come in and initiate the relaxation response, which is supposed to return all those systems to normalcy. I always liken this to kind of your HVAC system, and your autonomic nervous system's operating kind of like the thermostat. The sympathetic is the heater. It kicks in, turns things up, heats things up to ensure that we're at that phase where we can survive this situation. The parasympathetic is supposed to kind of kick in as the AC, cool things down, get them back down to that comfortable level. The problem is for many people in general, whether they're experiencing chronic conditions or not, is that there's an imbalance in how this is working on a consistent basis. What might be happening is the sympathetic is really good. You're really good at getting stressed. It's the relief part of that stress response that's not kicking in a way that's allowing for that kind of rest and digest or rest and recovery process to happen. If you look, all of these systems really kind of tie into some of the basic symptoms that a lot of us explain when we're stressed. Things like tummy aches. Your stomach, like I said, is really involved in the stress response. How your stomach breaks things down, your digestion process, factors of your bladder function could be part of this. It also has to do with heart rate. A lot of the time when you're stressed, your heart rate's really fast. And for some people, they say it can be difficult to catch their breath, or they feel like they are sweating a lot. Sweating is a really common thing. And so, what we want to do is create a better balance between these two sides of this system. What this might look like in terms of a balanced chronic stress would be something like this. So, imagine what your day looks like on a regular basis. You go through this almost every single day in some way, shape, or form. You may never get over that state of overwhelm line. However, there are little things that happen throughout the day that prompt our stress response to kick in. But as soon as they turn down, that parasympathetic kicks in to get us back down to that baseline. So whenever I am talking about stress in our classes, we teach in person here on the Mayo campus. I always use the example of driving into Mayo as your day. If you live locally, you probably know some better routes in terms of traffic. If you don't live locally, you're probably very confused on San Pablo Road while you drive on the left-hand side for about 12 seconds, and then you go back on the right-hand side, and you never really know why JTB always has so much traffic. And what happens is anytime you experience things like traffic, or you can't find a parking space, or you have to go to the south side of the Mayo building, but there's only an east elevator, that doesn't make sense. Your body goes through this same type of response each time you experience one of those little hiccups. What happens though, as soon as you move past that, the parasympathetic kicks in and gets you back down to that baseline. What happens though for a lot of people, those dealing with chronic stress, dealing with chronic conditions, or loved ones of those dealing with chronic conditions, is that balance is off. And it looks much more like this. What happens is the sympathetic kicks in where it needs to. It's really good at triggering the changes in the system. But what starts to happen is the parasympathetic, even though it might be kicking in, is not getting us back down to that baseline level. And so, what we want to do is look at ways that we can really kick this off so that the parasympathetic is not only getting us back down to baseline, but in some cases, getting us below. By doing this, it's helping the system as a whole return to normalcy so that the operations within the body are going to work much more effectively. And so when I say operations within the body, I'm talking about a lot of different things. This could be related to pain, it could be related to chronic fatigue. A lot of people say, when I'm really stressed, I'm really tired. I find that it's really hard to focus, that brain fog factor being one of those. And so it can also start to impact how other things work in the body. Again, the digestion, but also, how our skin responds to certain things. Hydration could be a factor related to this. And so what we want to do is not look at eliminating stress because that's not a reality. And stress is actually very important in terms of finding a good balance. When it comes to stress, stress is motivating until a certain point. When it exceeds our ability to manage it, it actually pushes us in the other direction. It can be demotivating. It can prompt us to procrastinate. It can stress us in a way that really just loses all motivation and can become problematic for our day-to-day functioning, whether it be on a productive level or on a social level. Sometimes social interactions can be those stressors for us. When it comes to activation of these different types of sympathetic signals in the system, they can fall under all of these different categories. From a physical standpoint, as I mentioned, the way that the system changes, it can increase sweating, your body temperatures increase, your heart rate, your blood pressure, which oftentimes, if you're experiencing high stress and you're going into a doctor's appointment, and one of the first things that they do is they take your blood pressure and they want to ask, is there anything going on today that changes this? And, your blood pressure is a little high today. And so what's going on? And oftentimes, a lot of us say, I'm just pretty stressed. It's prompting that change. It also could prompt changes like palpitations, things like tachycardia, hypertension, because of what's going on in that system. It also could result in some of those symptoms related to dizziness, lightheadedness, sense of imbalance, but it also has an impact on how our muscles feel, relations to pain, body aches, maybe also factors of like clenching our teeth. And so jaw tension or what we call coat hanger pain. So between the ears and the shoulder blades oftentimes tends to be where a lot of people carry stress tension, which can also lead to headaches, whether it be tension headaches, migraine headaches, maybe changes in appetite, which also could have an impact on your bowel system, irritable bowel type symptoms, whether they be chronic constipation, chronic diarrhea, maybe even things like nausea or vomiting. A lot of times, patients, when they are experiencing a lot of these symptoms, as well as their family, your eating habits aren't going to be the same as they would if you weren't experiencing stress. Sometimes eating habits change as a behavioral standpoint, but then really impact us on a physical level. Same with our bladder. A lot of the time when we're stressed, when we're hyper focused on something, it could be really easy to forget to eat meals. It can be really easy to forget to drink water and stay hydrated. And so that then has an impact on how the bowels and the bladder are really operating. It can also prompt more fatigue, but it also can prompt more insomnia, which kind of seems counterintuitive because you think, I'm super fatigued. All I want to do is sleep, yet I can't fall asleep. When it comes to sleep, most people don't sleep well, regardless of conditions, regardless of what day to day looks like. Sleep is your body's natural phase of recovery. This is where we get the physical recovery, but it's also where we get a lot of that mental and emotional recovery. We process our emotions through sleep. We form memories. We dream about things. And a lot of the time, the stress response can really impact that. But stress is one of the things that oftentimes people say keeps them up at night, whether it keeps them from falling asleep or staying asleep. Weight loss, weight gain could be a factor associated with some of those eating habit changes. Maybe even impacts on sexual desire, sexual function could be part of this that operates within that autonomic nervous system as well, along with things like skin changes. Stress acne has been a phrase that I've heard since I was 12. And so I think most people have heard that phrase, or, my skin is just not that great. I'm super stressed right now. Maybe it's my skin is super dry, or I've been breaking out in a different way. That could be part of that stress response on a physical side of things. Additionally, other sensitivities. This could be sensitivities to things like lights, sounds, maybe even smells that prompt kind of other responses that you see on this page. So sometimes sometimes those sensitivities might make us experience some kind of emotional response. Maybe it be things like irritability. Maybe it also be kind of triggering the bowels and triggering things like headaches. On an emotional level, oftentimes stress can really impact us on an anxiousness or fear side of things. A lot of that falls under that what if factor, as I mentioned. Things like nervousness, maybe feeling overwhelmed. A lot of people, when they're stressed, actually procrastinate a lot. And so when we procrastinate, we push things off. And so when we push things off, we then have to do a lot of things all at one time, which can really ramp up that sense of overwhelm. But also through that parasympathetic imbalance, what's happening with the sympathetic constantly flaring off in the way that it is, the body is also perceiving that it's overwhelmed. A lot of people might report things like mood swings, maybe crying more easily, but also being able to manage stress is one of those things that emotionally people recognize is much more difficult when they're experiencing greater amounts of stress. They say things like, I used to be able to manage stress really well, or now every little thing stresses me out, whereas before I feel like I used to be able to kind of push through my whole day and not have any kind of stress. That sensitivity to stress itself is really ramped up. But also things like impatience that might lead to things like anger. Anger is one of those secondary emotions. Also, oftentimes it's not the first thing we experience, but oftentimes when our body is in that chronic state of overwhelm, it's much easier for us to fall into that side of anger as well as frustration. Maybe it also includes sadness or worry. And one of the things that oftentimes we hear from our patients is the guilt factor. And that simply is the guilt of, what am I doing that might be kind of causing harm, whether to myself or to the relationships I have with the people that care for me. The caregiver dynamic is really difficult to navigate because these are people who love you. They care for you. You care for them. And sometimes when our stress is really ramped up or our body is changing in ways that we're not really sure what's going on, or we're not really sure where it's headed, we say and do things that might not be fully representative of who we are. And sometimes it comes out as one of these emotional responses. And oftentimes that kind of response does trigger a little bit of that guilt along with it. On a cognitive side, poor concentration is very common when it comes to cognitive impacts of stress, difficulty focusing, feeling like you're trying to do way too many things all at one time and not being able to do really any of them well. Also, memory loss, memory lapse of, why in the world did I walk in this room? What was I in the middle of saying? Or I'm not really sure where I was going with that story, or I can't remember where I put my glasses. I had a patient who said that one time her brain fog was so bad that she lost her glasses for a week, and she found them a week later in her refrigerator staring back at her. She said, all I could think about was, why in the world would my glasses be in the refrigerator? And so she trailed her steps back, and what she realized was about a week before, her teenage son was in the refrigerator and pulled out the orange juice and drank the orange juice. And the rule in their house is that whoever empties the container has to throw it away and write it on the grocery list, right? It's pretty legitimate. Well, he didn't empty the orange juice. There was like, I don't know, a quarter of an inch of orange juice left in the bottle. Wasn't even a sip. But he didn't empty it, so he didn't throw it away. Well, mom opened the refrigerator later that day, pulled out the orange juice, and said, why in the world would he do this? But she had her glasses in her hand. She pulled the orange juice out and said, something's supposed to go there, put her glasses there. She drank the rest of the orange juice, closed the fridge, and went on about her day. She didn't find her glasses until after she had gone to the grocery store a week later and bought orange juice and went to go put it in the fridge and said, oh my gosh, there are my glasses. They were staring at her for a week, but in her mind, why in the world would her glasses be in the refrigerator? So why should she be looking there? But also, she didn't even recognize them when she would be in there because it didn't make sense for it to be there. That was that cognitive impact. That was that brain fog that was really impacting her ability to kind of see the details. And so sometimes it's focus on what am I currently doing, but also focus on what do I normally look at and what might not be right in this situation. That can also really increase dynamics related to confusion. She was very confused as to why her glasses were in the refrigerator. Then she kind of backtracked and figured it out. But this could also present as things like difficulty with word finding. I had a colleague who said she had brain fog so bad one day, she stood there and explained to her husband, "Oh, I can't find the thing that has a metal end. It's on a wooden stick. You put it in the ground, you stomp on it, you pick up the dirt, you throw the dirt. It took her 10 minutes to describe a shovel. She couldn't think of the word shovel. She completely knew what it did. She knew what it was for, but her brain just wouldn't find that word. And so oftentimes stress does that to us. On a behavioral impact, it can be changes in eating patterns. Most people go the more unhealthy route. My house, we are no stranger to what we call vampire lasagna. It's chocolate cake. And so chocolate cake can be really great. We love it, but it's also not something that we probably want to have every day. But when we have stress, sometimes our eating habits change. Same with our sleeping habits. As I mentioned, insomnia might not be something that you experience on a regular basis, but when your stress is pretty high, you might have difficulty falling or staying asleep, as well as getting comfortable to sleep. Again, the body is changing, and some of that body aches, the muscle tension might actually be what's keeping us up at night. It also can have an impact on our mood, that irritability factor. One of the big things that oftentimes happens when people are really stressed is we start to withdraw or we isolate from the social support networks that we have. We say things like, I'm just so stressed right now. I need to just stay at home and recoup or kind of refresh. And we try to do things that we really like, but oftentimes that does mean that we're doing them without the people who are part of our day to day, which can then actually lead to decreased activity, maybe more of that procrastination. But also sometimes the people that we see a lot of the time are very, self-motivated, very driven, very want to kind of push yourself to do the things that you want and know how to do. And sometimes that can result in us setting unrealistic expectations, not only for ourselves and what the role is, but also for other people that can really start to have impacts on what we're able to achieve throughout the day. And we might actually start spending more hours doing less work, feel like we're always trying to get something done, but never actually getting to the end of it. In some cases, we might actually depend a little bit more on chemicals, things like caffeine. Are a big one that people like to depend on for stress, things like coffee, energy drinks, but also medications. Sometimes when we're stressed, we get things like headaches and, over the counters that are designed to help manage headaches or prescription medications might be something that we find we have to take more frequently to manage that symptom. In some cases, that might be alcohol. Some cases, it might be nicotine or other products that you might use on a consistent basis because we found some relief there at some point, as well as things like our appearance. Sometimes when we're stressed, we don't make time to manage the things that are part of our day to day presentation. And so that might be, I normally have an appointment every 6 weeks to go get my hair cut, but this time around, I'm so stressed, I'm going to cancel the appointment. Or it could be, I was going to go home and I was going to give myself a little bit of kind of a spa afternoon, like shower, do all of the fancy creams, lotions, whatever your preference is. But, I'm just so stressed. I have too much stuff to do. So I'm actually going to take some work home and do that instead. We kind of push off the things that are part of kind of that comfort side as well as appearance side and kind of self hygiene side of things for the sake of the things that tend to be considered productive. That's a natural human thing. A lot of us do that. We're kind of conditioned to do that from a very young age. We actually, if you got sick in third grade, you woke up one morning and said, I have a tummy ache. And mom said, don't worry about it. You can stay home from school. You got to stay home, lay on the couch, watch all your favorite cartoons. Your siblings weren't home, so you got to pick what was on TV. You didn't have to worry about anyone else changing the channel. You got to eat your chicken noodle soup for lunch. 2:30 rolls around, you start feeling pretty good. School gets out, your next door neighbor comes over, knocks on the door and says, "Hey, can you come out and play?" Mom says, "Oh, no, they didn't go to school today. They weren't feeling well, so they'll actually just see you tomorrow." That's pretty standard, right? Mom wants to make sure that you feel well, can go back to school tomorrow. But what that did was really plant this message in your mind of if you were too sick to go to school today and be productive, you're probably too sick to have fun. And as adult people, we kind of follow that mindset. We say things like, I didn't finish my work today or didn't finish cleaning the house, so I shouldn't go do this, or I'm not going to do this because of this. We really try to prioritize the productive stuff. The problem is, the productive stuff is what stresses us out a lot of the time. And so, what we want to do is really look at finding this balance that incorporates the ways that we're really looking at self care for our body as a whole. Like I said, self care is not all the fancy stuff we're seeing on the internet. It's what we're doing to take care of that human body. And so to do that, we want to really look at ways that we can find this kind of balance in managing this stress. As I mentioned, stress is important when it comes to energizing us and motivating us. It increases with that different impact, whether it's going to be on a physiological side of things or a mental or emotional side of things, but only up until a certain point. The level depends on you. It depends on what else is going on throughout your day to day. It depends on the certain task that you're working on. And the goal is not to eliminate it, it's just to find the best way to manage it so that we can find the best way to perform within it. And so, what we want to do is really focus on what we can control. And first and foremost, that's going to be that self care. What are you doing to take care of your human body? What does it look like in terms of nutrition? You know, I have a lot of patients who get to the end of the day who say, I can't remember the last thing I had to eat. Or, I think I missed lunch today. Or, I haven't eaten in a little while and I don't remember what it was that I ate. Nutrition is really key when it comes to managing your body, managing care related to things like your immune system. A majority of your immune system lives in your gut. Your gut is fostered by the food you eat. But then also your fatigue. Your brain is about 2% of your body weight, but uses up to 20% of the energy that you get from resources like food. So if we go long periods of time without eating, your brain's got to get that energy from somewhere else. And so it's going to turn to the muscles. It's going to really try to pull that glucose, pull that fat to try to really get it going. The problem is it's not sufficient for function. So now your brain is fatiguing your body. Self care also includes things related to what am I doing for practices of relaxation? Relaxation for the body does not just mean laying on the couch watching your favorite episode of Ted Lasso or whatever your Criminal Minds or whatever show it is you like to watch, but it really is what are we doing to kick off that parasympathetic activity? And so practices of things like guided imagery, deep breathing exercises are really powerful in kicking off that parasympathetic activity to create a better balance. Also, things like exercise and movement. Exercise does not mean that you have to be a bodybuilder or an Olympic runner. It is what do you need to do to make sure that you can get through the different activities of your day. And so, aerobic conditioning is a great way to get the body going, gets that cardiovascular system going, but also gets us into this area of where our brain functions kicking up. Exercise actually kicks off those feel good chemicals in the body, the endorphins and then the enkephalins. Those endorphins are your body's natural painkiller. They also really activate that cognitive function. And so trying to get in some of that exercise throughout the day is really important. And it could be 10-minute walks a couple times a day. And when I say a walk, I'm not saying you got to break a sweat. It's something as simple as, I'm going to walk down to the end of the street and back, or, I'm going to walk up and down the hallway a couple times. It could be something simple just to get your body going to help kick off those chemicals. On the other side, one of the things that we can control is our time management. How we're really engaging in what are the different things that are part of our day to day. And that requires us to prioritize certain things. Recognizing is it important to us or can we let it go? So, this image here, this little chart's a simple way to do that. Identifying things that you can control versus things that you can't is really important because there are some things that create stress for us that are beyond our control. Being in traffic. If there's a car accident up ahead and you're stuck in bumper to bumper traffic, we can't control that. Versus running late because I wasn't watching the time, that's totally different. And so, looking at ways that you can identify what's important to you, but also what you can let go of. And so, we want to identify healthy strategies that can really prompt us changing our view on how to manage this stress, but also recognize when there's things that we can just let go of. There are things that sometimes stress us out that maybe stress us out a little bit more that are beyond our control. I know for myself, when I start having full-blown arguments with the steering wheel in my car while I'm driving home at the end of the workday, that I have some things I have to control for me, but there's also things that maybe are beyond my control. So that's that signal to me of, whoa, maybe I should take a deep breath, take a step back, and just evaluate. But recognizing what this looks like for you is going to be different per day. It's going to be different per situation. It's going to be different per what the experience of, it's Tuesday at 2 o'clock and, I was on my way home and there was no traffic versus there was traffic. It's going to look very different per situation. So having different things kind of in your tool belt that are designed to help manage this stress is really important because what might work one day may not work another. And so having many options is really helpful. When we do look at stress management, one of the things we really want to focus on is the dynamics of isolation. I mentioned that one of the behavior changes for stress responses is this withdrawal or isolation. Isolation is one of those things that for patients with chronic conditions or patients with chronic health issues have been doing for a really long time. It's not new. COVID kind of created this new burden of isolation because you actually were forced to isolate. You were told if you had COVID to stay away from people for a certain number of days. And then people had to stay away from you, and you pulled away from work environments, you pulled away from social interactions. And it really had an impact on the kind of scope of how you chose to engage in things, but it had an impact on people as a whole. And the Surgeon General's office actually did a study about 9 months ago now, where they looked at isolation. And based on the impacts of isolation, they identified it as equal to smoking in terms of risk of death. And when I say smoking, I'm referring to someone who smokes a minimum of 15 cigarettes a day. So this is not a casual smoker. This is someone who is a much more lifelong smoker. And that risk of death really has an impact on us both on a physiological as well as a psychological level. It impacts the relationships we have with people. It impacts the things that we do on a consistent basis that are part of that self-care and health. And so there are a lot of reasons to be isolated, but also we want to get back to that social dynamic simply because social support is actually identified as the biggest buffer for stress. Now, social support means something totally different per person. I myself love good social support when I'm sitting on my couch and the people who are supporting me are sitting on their couch and we're talking through the phone. Social support doesn't always mean you have to be in the same room, doesn't always mean you have to get all dolled up, go do all the fancy things, be gone for hours. It could be exchanging a text message. It could be reading a book together and being in a book club. It could be a faith-based group. People form relationships in different ways. They say that the primary relationships of someone like a spouse or a partner, a parent, maybe a sibling or a child, even a roommate or best friend are going to be some of the most in depth of these relationships and these support factors simply because these are people who know you. They know you for whether it be a long time or in terms of quality and depth. They know your personality. They know things about you with you out without you even having to tell them. And so these are going to be great levels of support, but also a lot of people get great support from being part of faith groups, special interest groups. I myself love to read. I'm part of a book club. My book club started before COVID. We used to always meet once a month at a restaurant, talk about the book, eat dinner, have a great time. And then COVID happened, and we ended up moving to Zoom for the first couple months. And we decided actually to keep it on Zoom. And it's 2025, and we still do it in Zoom. What we found is more people could come. We were able to continue that on. Whereas if we had tried to go back in person, we probably would have found that a lot of people would have to miss pretty frequently. And eventually it probably would have just completely fallen apart and disbanded. And so finding what social support looks like for you is really important. All sources of social support count. Whether it's somebody that you just talked to through social media. I use the example of people who play video games. Um, I used to work with kids, and video games are a big part of their day to day. And you can play a video game with somebody who lives in another country because of how those things connect. You might not actually know that person other than their handle on the video game, but they're a social support for you because of that liked interest. And so we want to get back to social support, but I want you to do it on your terms. And so what we encourage you to do is accept social invitations that you feel safe in doing. That also might mean setting limits in terms of how long you're there. Things like the 30-minute rule can be really nice. Go, be there for 30 minutes. I have a colleague who says if you get invited to go to the prom, stay for the weird, awkward photos, and then leave. You don't have to stay for the whole event. Also, there is no harm in getting really good at what we call the Irish goodbye. And for those who don't know what that is, that's leaving without telling anyone. But finding those opportunities to say, I've hit my limit, but my limit should not be when I feel burnt out. It should be, I still have some gas in the tank, but I'm not going to overdo it because I don't want tomorrow to be a bad day. So start with 30 minutes. Go set a timer. When the timer goes off, leave. If you go with somebody else, let them know ahead of time. Say, hey, we're only going to stay for about a half an hour. When I give you the signal, whatever that is, I mean, I'm going to pat my head and rub my belly. That's our signal. We're going to go. Or it could be I give you a high five sign. What that means is we're done for now. It was great to be here, but I'm going to go. When you do that, there's also really kind of no reason that we have to explain to other people why we're leaving. That can be a real challenge for a lot of us. If you're out with friends or you're out at some kind of gathering, you say, "All right, I got to get out of here." People always say, "Oh, why are you leaving?" It's really easy to want to explain, I feel too tired, or, my symptoms are pretty bad, or, I want to get home to do X, Y, and Z. One thing that's really great in terms of really harnessing this social support is being comfortable with not giving the details. So things like, I got to get out of here. I've got some errands to run, or, I've got some places I got to be, or some things I got to take care of. Everyone understands what the things are or the errands are, so they don't usually ask. And so it's an opportunity to get out of there. What I will tell you is whenever I use that excuse, 9 times out of 10, I got somewhere to be means on my couch watching TV with my dog. That's a comfortable place for me, but I've hit my limit. And what we find is sometimes trying to force yourself to stay too long becomes the stressor. And so we want to find the right balance. And if that means starting with modifying things like maybe connecting virtually or over the phone instead of meeting in person, but also modifying. So if you get that invite, hey, we want to go out to dinner. I'm not really sure I can manage dinner, but what if we met for coffee earlier in the afternoon instead? Or what about breakfast? I'm a little bit better in the mornings or maybe in the middle of the day. Offer those modifications so that you can still stay involved, but not feel like you have to force yourself to fit into what the original invite might be. When it comes to reducing stress, we really want to focus on what we can control. And so, again, making self care that priority, things that we're doing to take care of that human body. And everyone has to do this. We also want to look at simplifying wherever we can, trying to really focus in on one or two things at a time rather than trying to focus on all of it together, because that can really ramp up that cognitive impact, that brain fog. One of the things, too, is really focusing on getting enough sleep, getting good sleep. As I mentioned, most people don't actually get good sleep. And so finding ways to create a routine that's going to help not only get enough sleep, but get deep enough sleep, get that quality sleep. Things like exercise as well as relaxation practices can assist with that. Mayo Clinic has some great resources on relaxation practices on our website through patient education. They have some great videos, but also, YouTube has a wealth of information out there in terms of practices of these. So find one that you like, practice it on a consistent basis. Maybe it's something you do before bed to help yourself wind down, but also looking at ways that you can ask for help, maybe delegate some tasks. But also, one of the things that we really want you to do on a regular basis, and when I say regular, I want you to try to find time every single day to do something you love, whether it's an activity, um, time to meditate, time to practice relaxation, spending time with your loved ones, spending time with your animals. For me, one of the things I do every day that's really part of this care is I walk my dog and I listen to a podcast. It's something that's interesting to me. I'm outside, I get that great refresher before I move on to the next phase of my day. But also looking at things that you can do to have fun, laugh. Exercise, as I mentioned, kicks off those endorphins, but so does laughing. Laughing kicks those up as well. And so those can be really helpful in managing chronic pain and chronic fatigue. But then also finding time to spend time with positive and supportive people. Now, we do recognize sometimes those are not the people who live in your house. And so finding the right kinds of people who are going to be your support network when you need it is really important in managing this overall. All right. Now that I've talked for an hour, does anyone have any questions? Is there anything that I went over that anyone is like, I'm not really sure what that means? I'm going to stop sharing my screen, Jeanette. But anything that I talked about that like resonates with anyone, anything that stands out is I saw some head nods and some kind of giggles to certain things. And so some of the basics that I know really do resonate in terms of kind of the procrastination, the symptoms of stress. But anything that stands out or anything that you have questions on?
Or if you prefer, you can always throw it in the chat. For me, Kristen, I'm still thinking about vampire lasagna.
Yeah,
Maybe
that's
it's
one of those
because
things.
the red is removed. There's no red sauce, right? Because it's chocolate. Is that why we
Yes.
call it vampire lasagna?
We call it vampire because it's layered. Good chocolate cake has layers.
And
It's got
nothing
the,
red in there.
yeah, so that vampire lasagna. We eat a lot of chocolate cake in my house. We are chocoholics, and if you get a good chocolate cake, it's nothing better.
Well, it
Yeah.
sounds healthy when we call it vampire lasagna. So
Yes.
I'm going to start that myself.
Yes. Anyone have any stress responses that they know of that they do kind of on a consistent basis that maybe I didn't mention? I have some patients who talk about things like nail biting. That could be one, or like um, picking at their fingers, kind of things like that. Um, Trying to think of some of the other ones I've heard.
I know a lot of you have some really good ways of coping with stress because I get to hear about them when we do your initial assessments and we talk about
Oh.
stress in your life and how you cope with stress. Anybody have a technique that they use to relax or something that helps, especially on those like dialysis days or
Hmm.
your particularly hard days? Anything that's helpful for you that you want to share with the group? I've heard some good ones over the years. We have an unusually quiet group today, Kristen.
That is okay. It's a Wednesday, and I mean, we're we're trucking.
That's okay. Everyone's practicing knowing their boundaries. They're not feeling
Yes.
comfortable sharing. That's okay. You're just here to listen. That's okay too. We appreciate that as well.
Yeah. Well, and stress is one of those things that I think everyone experiences differently. And sometimes, when you're kind of in the heat of the stress, heat of the moment, it is hard to recognize what some of those stress responses are. And what's challenging sometimes is we don't notice them, but somebody else does, and they call us out on it. And
That is
so
so
that can
true.
be pretty hard. I'm also a stress cleaner, and the other people in my house hate it because I'm one of those stress cleaners that I organize to the point where I put things in weird places, and a lot of the time that weird place is the trash. And so
Mm.
things go missing.
I like to do that too, throwing things
Yes.
away.
Yes.
Yeah.
Yeah.
What you think's interesting thing about stress to me is that sometimes it kind of builds up on you slowly, so you don't really notice it
Yes.
so much, and then you can get to that overwhelmed part,
Mhm.
space that you were talking about without even realizing that it was kind of creeping up on you. But then also sometimes you can actually like some of these relaxation techniques that you practice
Mhm.
can help like lower them down, and then you don't
Yeah.
even realize that it's been helping until it's like, wow, I haven't been grinding my teeth in a while, or
Right.
I've been sleeping better. I've
Right.
noticed that myself with my yoga practice that like I've been
Mhm.
for the past, 2 years or so, I've been doing yoga and
Oh, yeah.
I'm like, oh, you know what? I actually sleep a lot better now. But like if you were to
Mhm.
ask me, like a year into it, I would have been like, I don't know if I really noticed much difference. But like when you
Yeah.
really think about it, because it just kind of there's no magic wand in life. So it doesn't
Right.
always like magically, I'm all better now. But it does
Right.
like when you really look at it kind of critically, it's you
Mhm.
can reflect back on it and be like, yeah, there are some changes but it might happen
Absolutely.
slow.
Absolutely. And, you know, sometimes we don't notice we're doing it until we're no longer doing it. And
Mm-hmm.
so we recognize some of those changes. But when it comes to those kinds of practices, like you mentioned, yoga, that's part of that relaxation realm as well. So things like guided imageries, deep breathing exercises, yoga, even Tai Chi. Tai Chi is really great for the body, just like yoga is in terms of not only the meditative side of it, but also getting the body moving. Tai Chi is really nice because it's kind of continuous movement. So you're not putting yourself in interesting, difficult poses like you might do with yoga, depending on the yoga practice, but finding ways to get that in. And sometimes that just simply means things like taking a deep breath. If you've ever been in a period of high stress and someone says, "Whoa, take a deep breath," it's not because they're trying to get you to like not think about it. It's really kind of that activation of the parasympathetic activity. Taking 3 deep breaths can do wonders to balancing out that stress response. And so, even if you find I'm going through a little bit of a stress right now, or I feel like I'm getting really overwhelmed, giving yourself a couple minutes to take 3 deep breaths, full deep belly breaths. So, really making sure that you're getting low. We call it abdominal breathing or diaphragmatic breathing, really kicks off that parasympathetic activity and really gets us back towards that relaxation phase and that rest and digest. So,
Yeah, I love that. That is so helpful. I had someone suggest to me one time about setting an alarm on your phone to like remind you to
hmm
take some, some deep breaths. And we, with
yeah,
transplant patients, we're always suggesting you set alarms to remind you about meds, right? We want you to stay on
yes,
top of all your meds
yes.
and all your medical practices. So, I
Mhm.
mean, adding in some kind of reminder about breathing or combining that
Absolutely.
with another something else you do on a regular basis, whether that's,
Oh,
hey,
yeah,
I take my meds and then I spend a minute taking some deep breaths, can be helpful as far as just helping you stay a bit more relaxed throughout your day when you are going through
absolutely.
times of stress.
Absolutely.
Anybody else want to chime in? I feel like it's just been you and I, Kristen, just chatting,
Yeah,
but which is nice. But yeah, if anyone else
yeah.
has a question, we'll give you one. We have another minute or two. If anyone has a question or a comment for Kristen. All right. Well, thank you so much, Kristen, for joining
You're
us. That
very
was
welcome.
absolutely wonderful. I know we all appreciate it. And yeah, we would love to have you again sometime. And thank you so much for coming. Thank you, all of you, for joining us as well. You
Yeah.
guys know our group is, it's the fourth Wednesday of every month. It's always from 2 to 3 on Zoom. Yeah, we send out that invite about a week beforehand to tell you what our topic is and let you know that you can register and join us. I'm not sure of yet next month's topic yet. I can give you a little preview though for June. Our June group, we're going to have one of our medical directors from the Department of Bariatrics talking to us about obesity and treatment for of weight loss. So that's coming up in June. So stay tuned for that. And then I'm sure we'll have another wonderful topic next month as well. All right, everyone take care. Glad to see you all. Bye bye.